Hello, everyone, and welcome to Building Our Emotional Vocabulary. I'm Kelly Kraft, Program Manager at Gildas Club Quad Cities, and I'm here with one of our awesome interns, Teresa, and she is going to take it away. Teresa, go ahead.
All right, let me go ahead and screen share here. Oops, say share. Okay. Kelly, can we see this okay?
Yes.
From beginning. There we go. All right, full screen?
Yes.
All right, okay, awesome. So for the Facebook Live people out there, as Kelly had said, my name is Teresa O'Keefe and I am a Gildas Club intern. I am a social work student at the Graduate School of Social Work with the University of New Hampshire. And we're going to talk about building our emotional vocabulary and how that relates to cancer. So we'll kind of go through our agenda really quickly just to give you a little idea about what we're looking at, kind of what to expect. So obviously figuring out what that even means to have an emotional vocabulary and building it and sort of defining some terms. We'll talk about some examples, why it's important, how it relates to cancer, and then where do you start this process? How do you even kind of get the ball rolling? Why it's difficult, and then we'll have a little bit of time for questions at the end. If you're joining us on Facebook, we can answer those questions via comment. If you're with us on Zoom, then we can answer those live. So the first thing we want to kind of get started here, when we talk about expanding your emotional vocabulary, what does that actually mean? Obviously, we all, can define what a vocabulary is. We use that on our day-to-day basis. And that's just a variety of words and terms that we can use to label stories, to give depth to how we speak. And the same thing can apply for talking about your emotions. So when you're working on expanding your emotional vocab, it's a process of digging more deeply to identify exactly what you're feeling, and giving actual names and accurate names to what those feelings are. So this could also be defined as labeling. Sometimes this will look like giving a more specific term to a feeling, an emotion, an experience. But labeling can also just be the process of re-identifying what your old emotional labels are. So if you're sort of reflecting on a situation or reflecting on an experience, and it used to be, maybe you're labeling it as angry, and you go back and do some reassessment, you're labeling now as frustrated or concerned or confused. Those are ways that you can sort of reassess what those things are. But let's work around the abstract a little bit and talk about some examples. Oops, space here. 1 second, make sure I get through my slides. Oops. Okay, there we go. So these are just some rhetorical questions that you could ask yourself at home. But when you look at the pictures on the screen with some different facial expressions, you could give some idea about what those might mean for somebody. There's a lot of different examples, or a lot of different ways that those could be labeled. But some of the probably more likely ones that you might come up with would be among these 6, give or take a few. This person, the middle top row, could certainly look happy, and you kind of go through the frames. Someone might look tired, sad, frustrated, angry, upset. These are all pretty easy possibilities that someone could be feeling if you're just looking at those pictures. But when we talk about expanding this vocab, what you might actually come up with is some of these people could be feeling disgusted, maybe feeling embarrassed, feeling jovial, sort of overly happy, or with a lot of excitement or happiness, maybe agitated, overwhelmed or overcome, exasperated, perplexed, proud. There's a lot of different ways that you could say essentially those 6 words at the top with more depth, and probably more accuracy and more specificity. So the job of the emotional vocabulary is to work on including not just only those 6 words at the top, but those words at the bottom, and to have a better idea about what those mean and what those feel like. So here is sort of another good example. So imagine this scenario. So you have a family of four. Dad works full time as an accountant at a big company. Mom is a stay at home parent of two kids. Had been diagnosed with lung cancer, was in remission for a while, but recently looks like her scans have showed signs of recurrence. And after that scan, um, dad is now withdrawing from his family. He's appearing angry. He wants to be alone. And his family doesn't know why he's acting this way. That's kind of what his outward symptoms are. So, again, kind of a rhetorical question, but what might this parent be feeling in this time after his wife has just been diagnosed? He's working, he has two kids. Outwardly, he certainly could appear um, angry in terms of not wanting to talk to his family because he's upset about something. We may not know what. Aloof is another thing. He wants to withdraw. Uncaring could be another thing that he's outwardly looking like. But when you start to dig past those layers a little bit, here are some possibilities what he actually feels. Cancer diagnosis or reoccurrence, certainly feeling fearful, feeling helpless, feeling numb could absolutely be some of those layers that's under maybe the anger. If he's appearing aloof, that could be sort of an overview for someone who's experienced grief. If they're uncaring or appear to be uncaring, the layers under that emotion certainly could be that he's feeling depressed, he's feeling agitated, he may feel some shame associated with that situation. He may feel shame that he is um, presenting some of these emotions outwardly, but isn't able to express them. So we really want to be able to sort of uncover what are those major 5, 6, 7 emotions that we tend to label ourselves with, and dig a little bit deeper to sort of understand what's going on under the surface. And there's some important reasons why we do this. On the one hand, labeling is sort of a mental exercise, which can be helpful for our own sense of well-being. It can be helpful for our own sense of understanding our own emotions, but there's a bigger picture in how well it helps with our families and in our relationships as well. And we'll kind of return to that, but consider this as another example of why labeling is important. We do a pretty good job of being able to identify different kinds of physical pain. And there's a reason for that. So if you think about, you go to let's say that you have a knee pain. So you go to an orthopedic surgeon, and that doctor wants to determine what's going on with you. It could be that you have, this example, a torn ACL, you could have arthritis, you could have an overextended knee, there could be cartilage that's wearing in your knee, there could be some other kind of issue. And the doctor really needs to sort of know what kind of pain this is. Um, so he might ask you, is the pain sharp or is it dull? Is there swelling? Is it tender? Does that pain come and go with time? And the doctor will use those labels to help figure out what's really going on. Saying just knee pain in general isn't a very easy route to health because there could be a lot of different versions of knee pain. So by better labeling what you feel and better labeling what those symptoms are, it helps the doctor really be able to make a plan for you, and it helps to give you a really solid place to start, because they would certainly treat dull knee pain different than they might treat something that's nagging or has been sharp. Same thing happens under the emotional branch, is if we can better identify where we're starting and we can better identify what's really going on, it gives us a better roadmap to be able to make plans, to communicate, to work with maybe a therapist, or just give yourself some better roadmaps for success in the future, or at least to be able to cope better than what you may be doing. So this is kind of where we get into the authenticity part. Working on developing emotional vocabulary helps you and us be honest with what you're actually feeling. If we tend to hide under a guise of sort of broad emotional labels, it can also be easy to not really acknowledge what's going on under the surface, and that's going to be an important place to start. Another important part of working on labeling comes from the knowledge that um, just like with the knee pain, if we don't know what's going on, we don't really know how to respond to it. And not only do we not how to know to respond to it as ourselves, but it's also really hard to know what support we need from other people, especially our family members, friends, if we don't really know what's going on either. So that gives our family members and supporters a way to help kind of figure out where do we go. Communicating your feelings accurately is also a big part of being heard and understood. Oftentimes, if you again sort of hide under these generalized labels, you might be saying the same thing over and over. I feel angry. I feel tired. I feel happy. I feel sad. Um, but there's oftentimes more layers that need to get explored, and we don't understand that. It's hard to have other people sort of be able to accept where we're at and what we need as well. And like we've talked about before, labeling is really the first step in being able to make an accurate and healthy roadmap, and whatever that looks like. So that could be just having some awareness with yourself about what's going on. It could be working on coping and grieving a loss. It could be finding a starting point with a therapist. It could be creating better relationships with your family and loved ones. But we really have to have this place to know where do we go. So as we pointed out, this absolutely does relate to cancer. So the example was certainly cancer related situation, but anyone that has had a cancer diagnosis in their family knows that this sincerely and severely disrupts a lot of facets of both the individual's life and their family's lives. All of a sudden, what may have been working or what may have been going well may not be now. And what may have been your normal is likely not going to be normal, at least for a little while. And with such a big disruption of normalcy, there's often a lot of new and confusing and strong and complicated and undiscovered emotions that just sort of come up by nature. And therefore, by having a bigger and more expansive emotional vocabulary, this can be a starting point and a coping mechanism that both the family and individual can use to make sense with and overcome what are going to be fairly difficult circumstances, or at least to make an unideal circumstance better, so then we can at least communicate what's going on. So there's a couple of different ways to kind of get this started. The first one could be kind of in the present moment. So for example, if you're going throughout your day, you're going throughout your week, whatever your situation is, and you're starting to notice that some strong emotional response is happening. So this could be you're driving home from work and you've had about 10 too many stop signs, and you feel sort of that like frustration that's coming to the surface. And you've had a long day, and you're coming home to work, and you're just maybe not in a great place, and you start to kind of get that sense that like not in a great mood. That could be an example. It also could be when something maybe more disruptive happens. You have a pet that gets sick. You have someone pass away. You lose some kind of income. Maybe you lose your job. I mean, there could be lots of different prompts for strong emotional reactions. But at some point when you're feeling those, whatever the impetus could be, take some time and actually think about it. Start by trying to label anywhere from 2 to 4 words. How are you feeling at that time? And this is not a super, hard and fast boundary. If you can think of some more, great. If you can only think of one, start there. But just take the time to be able to recognize and think about like, what is it that you're feeling? It's important and helpful to think about what is the intensity of the emotion? How urgent is it? Is this an emotion that you feel has a lot of depth, Or is this something that is more new to you and may not be explored quite as well? And one of the really helpful tools you can use to work on sort of developing this vocabulary are a couple different visual ones, which I'll show you after this next slide. But um, use those tools and look at those and see if there's any that really stick out to you. See if there's any that make a lot of sense to you. See if there's any that you're like, absolutely not. This is not the emotion I'm feeling. And just kind of work on revisiting what those terms are. So start with those 2 to 4 and see if there's any that stick out. And it's important to, I think, point out that when there's a strong and emotional reaction happening for whatever reason, you may need to have a little bit of awareness to utilize some self-soothing techniques. So this could just be deep breathing. So again, you stop at the stop sign for the 10th time and you're feeling some strong emotions, and that just might mean that you need to take a few deep breaths to help kind of recenter yourself enough to think about what those 2 terms might even be. Grounding techniques are a good one. So for example, a grounding technique could be that you touch your thumb to your fingertips 5 times, and it's just a way to kind of build some body awareness. If you're in a situation that is perhaps chaotic, or that is one that you can take some time to walk away from, that could be one. Journaling is another one. This might have to be a little bit of a forethought, but whatever you need to do to get some awareness of what's going on can help get you started on those 2 terms, 2 to 4 terms. So after you've done this, you've talked about your 2 or 4 terms, you've looked at the vocabulary lists, you've maybe done some grounding and soothing techniques. Take some time to sit with it, revisit those, and see if there's anything that you want to change, see if there's any new terms that you come up with, see maybe if you have labeled some of those terms that aren't correct anymore, or maybe you have decided that one term was okay, but you can find some new ways to describe it later on. And this is all a very personalized situation. There's not going to be any way to say whether what you come up with is right or wrong. It's really just a process of building what your emotional terms are. Another good way to move from that step, or the next step might be, to identify what it is that you need from yourself and you need from others. So we'll go back to the driving scenario. So if you've gone on the 10th stop sign and you're maybe you're burnt out, maybe you're exhausted, maybe you're overwhelmed, maybe you're under-resourced. Maybe the thing that you need at that point is to do some self-care, go home and take a bubble bath, or go read a book, or go for a walk. And if you know that that's what you need from yourself, when you go home, maybe the thing that you do is talk to your spouse and say, this is how I'm feeling. This is what I need. This is what I'm going to do. And at that point, they may be able to either help you or at least support you on that journey. Which kind of brings me to the next point. And this is definitely an optional one, but once you've gone through this sort of beginning process, you might consider talking with someone who is a trusted and helpful supporter. And I really want to emphasize trusted and helpful. Share some of these sort of more personal thoughts and realizations with someone who has earned the right to hear them, and someone who is going to be there to appreciate what you've done for yourself, appreciate the fact that you've taken time to label your emotions, think about someone who is going to be there to support you on the way, and make sure that that someone isn't going to somehow impede your ability to work on the goals that you've identified for yourself. And that's definitely something only anyone can identify within their family, like who is someone that they can trust. But I would just pause to make sure that when you share with someone, or if you share with someone, that person needs to be someone that is really going to be helpful, and doesn't result in you feeling like you're maybe making the mistake, or your labels are wrong, and that can be a big sort of difference between whether these things feel helpful or whether it feels like they've been a waste of time. So this is a really great tool that I like to use in a lot of different scenarios to sort of work on this labeling process. This is just an emotions wheel. You can literally type into Google emotions wheel, and this will be one of the ones that comes up. But it takes some of those sort of big 6 or 7 emotional labels that we use often: happy, sad, surprised, fearful, angry. As that wheel gets bigger, those terms will sort of gradually extend themselves into more specific terms. So under the happy sort of like piece of the pie, instead of just saying happy, maybe what you're actually saying is you feel proud or you feel powerful. And then coming through that other side of the wheel, maybe you're actually feeling thankful, or maybe you're feeling curious, or maybe you're feeling confident. And these are ways to help sort of branch out what those common terms are. And you can do that with any of these. And I would even say that just because the wheel identifies them as angry, disgusted, sad, happy, surprised, bad, and fearful, doesn't necessarily mean you have to start with one of those terms. You might even just go around the outside of the wheel and see what sticks out to you, or go around that X inside of the wheel and see what sticks out to you. But I think getting familiar with some of these terms makes it easier to access once you're in a little bit more of that panic mode or emotionally heightened mode. So then it's kind of a practice of getting more and more comfortable with what those look like, and it becomes easier to pull them out. So this is another way to sort of start that labeling process. The first one, obviously, we were talking about, this is a very like in the moment scenario. Another way to approach this, though, is as kind of an afterthought. So you can set a timer. Some people like to have some boundaries laid out for when they're doing a lot of emotional work. So it gives them sort of a start and end time. But you don't necessarily have to do that. Kind of do what feels right. But if you are one of those people that does better with having some boundaries of like, this is when this exercise begins and ends, 20 minutes is probably a good time. But just do some time and think about what are some emotional experiences you've had from the last week, month, year, and write about those, journal with them. This could be anything from I was, having kind of a busy day and I stubbed my toe and got I got kind of flustered and upset. To some of those bigger ones, like we've lost our jobs. Someone maybe has moved away. You've had a child that has started college, whatever those things are. But just use your journaling as a time to reflect on those things. You definitely don't need to make it readable. It doesn't need to be pretty. No one needs to read this other than you. And give yourself some permission to let that writing kind of take you wherever it does. Oftentimes journaling is great because you don't really know where you're starting and you don't really know where you're going to end. And there's always some wisdom that kind of comes with it. But as you're doing that writing, practice identifying, wrestling with, and reassessing what your emotional terms are. Again, use those labeling tools like the ones we showed before. So maybe you're doing your writing and you're talking about you went into the office and you stubbed your toe and it made you feel some kind of way. And as that story kind of continues, maybe you're reassessing that with a different term. And maybe now you're identifying that not just feeling frustrated that you stubbed your toe, maybe you can now identify that you're feeling broken, feeling tired, feeling frustrated. Any of those emotions could maybe be behind that initial assumption, and the writing can help kind of bring some of that out in a way. Sometimes that conversation can get lost. This is also a good way because it can help you give something to reference back to. So if you're doing this a lot, sometimes it could be nice to see where you started and see where you're going and see maybe where you are now. And it's really all a matter of preference. I would even encourage doing both of these, that if you are kind of at a calm place for some period of time and you have the ability to do some self-reflection like this, great. It also can be helpful to do that first option where you're practicing some more self-awareness as it kind of continues in the moment. Again, always think about practicing the labeling of, practice identifying what it is that you need as a result of the labeling. And this is really that important part of how does this help us really in life? If we know where we are, we have a better way to understand where it is we're going, and therefore figure out how do we get there. So in that writing, you might think about what did I need at this time, or what would have been helpful, or what did somebody do that did work or didn't work for me. And it just builds that awareness. A lot of this is just the practice of having attention to yourself, having attention to your emotions, having attention to what it is you need, as opposed to letting it kind of sweep itself by in a whirlwind and not maybe taking the time to think about what it is that you need and think about what it is that could help in the future. Again, I would always caution that share this sort of stuff with a trusted and helpful supporter. As much as this could be a family member, a spouse, a relative, could be a friend, also could be a therapist. Therapists are sort of the tokens that will hopefully always be there to be that trusted and helpful supporter. And hopefully if you have a good therapist, they will be there to sort of ride this journey with you, and they may be able to help you with additional labeling and additional identification of what you need from them or they need from you. And certainly this can help your families sort of know what it is that they can do. If you're experiencing a frequent emotion and you're identifying what your needs are, and those needs tend to be repeated, your family may be able to then better sort of help give you what it is that you need, instead of having to wait to do a lot of processing, and then you're kind of stuck in limbo. So a lot of good things can be developed. It does take practice, though. So this is just a different version of an emotional vocab sort of outline. The first one was that pie chart. But this is just another way to look at it. Kind of the same idea, though, that at the top you have some of those big ones. Angry, sad, joyful, excited, confident, and then you have just different versions of what those words might actually mean. Meek is an interesting one. Revolted certainly has some pretty heavy weight to it. If you're saying you're revolted, that's a pretty strong word. Remorseful is another good one. Provoked, skeptical, ashamed, tender. All of these sort of have their own connotations to them. And I think it's really just a matter of you figuring out which one feels right and which one fits the situation, and being also okay with that. And we'll talk about that in a minute as well. I like the word wondrous as kind of as a side note under the excited column. So I think this is an important part to talk about. This is really hard. It is hard to sort of accurately label what's going on. It's hard to train yourself to react to your emotions in the present with some of those soothing techniques. It is difficult to maybe find someone with whom you can share these emotions, and it can be difficult to know what it is that you need. Fortunately or unfortunately, this isn't difficult for no reason. As we talked about at the beginning, we're really in a habit of labeling physical pain. So, or physical senses, physical awareness. So, saying that you're nauseous, saying that you have a headache, saying that you have throbbing pain, saying that you have sharp pain, saying that you have something that aches. I mean, those are really common ways to describe physical pain, but we just don't put the same emphasis or practice on labeling emotional ones. We don't practice on really using more than 5 to 7 sort of broad terms to describe what we're feeling. And there's a lot of reasons that might be. There's a lot of familial and cultural standards that are sort of at practice, and certainly different cultures, different families have different variations of this, different levels of this, but on sort of a general scale, we like to pretend and think that emotions should be suppressed, and we don't want to burden anyone with our emotions, and we don't want to share this because we could make someone else feel uncomfortable. And you should just look on the bright side and not worry about it. I mean, these are all sort of tactics to kind of suppress those emotions. And if you're told to suppress your emotions all the time, certainly it's going to be a lot harder, and there's going to be a lot less prompting to explore them with more depth. So that's certainly a big part of it. Along those lines, there's cultural standards that there's only a few emotions to choose from. You can only be happy, sad, tired, exhausted, angry, and that's kind of it. We just don't talk about them in bigger terms. If you think about how children express their emotions, oftentimes it's in those sort of big 5 to 7 terms. But as we grow, there's just a lot more that I think could be explored, and just that may not happen. Another thing is that therapy is often discouraged. Our culture certainly can stigmatize going to therapy, going to counselors, seeing any kind of professional help, and that's really their job, is to help you process these emotions, identify what's going on, identify what you need. So if we're not encouraged to go, it's hard to get the resources we need, and it's hard to then develop that vocabulary. Another big thing is it takes time and attention and emotional capacity to do all of this stuff. That's kind of why that 20-minute timer can be helpful within that second exercise, because if you're putting a lot of your sort of emotional energy into creating this thing, this list, this journal that's going through this emotional experience, it can be pretty taxing. And if you have a lot of other stuff going on, that certainly can take a fair amount of emotional work. And definitely if you're pragmatically pressed for time, you have 20 different things you need to do. You have kids running around, you have a job that's calling you all the time. You have to be a million places at once. Pragmatically, it's hard to physically take that time. And if a lot of is being asked of you frequently, it's difficult. But I think another big one, as we talked about earlier, is it can be difficult for people to have healthy and helpful supporters, and they may feel like they've tried to be a little more expansive on their emotions, and they've shared it with someone, and maybe it hasn't gone well, and that can be a big discouraging factor for people to do that and to work on expanding this vocabulary. Um, so I think it's really great when you have someone that can be that for you. And if it's hard to find someone, then I think that's definitely something that can make a difference. This is just sort of a disclaimer, but I do think it's important that ultimately when you're doing these exercises, when you're working through the labeling process, when you're talking about what does and doesn't work for you, what you need and don't need, there's really no right or wrong answers. There's no right or wrong way to feel. There's no right or wrong experience to have necessarily. And all emotions are valid and correct. Whatever you feel, whatever you come up with, that is in and of itself the right answer. And I think it's important to recognize that even if you go back and you say like, well, maybe this emotion wasn't right, or maybe this label wasn't right, on sort of forethought or after the fact rather, then that's part of that process, and that's okay. And I don't think that there should be any sort of maybe shame or embarrassment or regret in maybe mislabeling something to begin with. And it's really about the process, because the journey doesn't end, because life doesn't, life in of experiences while we're alive continues on. And so does the process of labeling these emotions. So it's really more of a matter of working through them, not trying to have all of the answers immediately. But also, I think it's worth pointing out to take the time to identify and explore both positive and negative emotions. So if you've had an experience that also is really great, and maybe you've had a really great day instead of a really crappy day, like we've talked about, take some time to think about that, and take some time to maybe identify what was so great about that day, or identify what that maybe goodness or positivity feels like. Was it pride, or was it joy, or was it a matter of feeling really confident, or was it a matter of maybe self-advocacy? Um, because ultimately, all of these things have something to teach. It's not just a matter of only ever dealing with negative emotions. This is emotional vocabulary as a whole. So taking the time to embrace the good and the bad certainly can provide with some additional insight. And at this point, I think I will turn it back over to Kelly, and we'll go from there.
Yeah, thank you, Teresa. Let me just take you off the spotlight here and have it on me. Teresa, can you stop sharing your screen? I think that'll, there, perfect. All right, well, anyone watching on Facebook, thanks so much for joining us. This was a really great workshop, and just a reminder, you can always join us via Zoom. You can sign up by giving us a call or sign up at gildasclubqc.org/calendar, because once we sign off of this Facebook Live, we'll have a little discussion amongst us and you can ask questions. So thanks everyone for watching. Have a great night.